Taylor is a 22-year-old female. She lives an active lifestyle where she plays netball 2 to 3 times a week. She walks the dog daily and she works as a lifeguard. She has one comorbidity, and that's asthma, and she has no serious injury in her previous medical history. Taylor was playing netball, jumped to catch the ball and landed awkwardly on her right foot with her knee fully extended. After landing, Taylor heard a large pop sound. There was a deep, aching pain felt immediately after falling. Within hours, there was excessive swelling of the knee. There was tenderness at the front and the medial side of the knee. When trying to walk and bear weight, the knee felt unstable and like it was going to give way. So Taylor, can you tell me a bit about the onset of your injury?
So the injury happened about 2.5 weeks ago when I was playing netball.
Yeah, no worries. So it wasn't too long ago.
No.
So can you tell me a little bit about the aggravating factors? What makes it worse?
Yeah, so it really hurts when I've been using it all day and like excessively walking or using it during the day.
Yeah, no worries. Is there anything that relieves the pain or makes it better?
Rest, but also sometimes when I'm sitting on the couch, I elevate my leg by using a pillow, and that seems to really help.
No worries. It's good. It's good that you're elevating it and resting a little bit. So whereabouts are you feeling the pain?
I'm feeling it in my right knee and
Yep.
to the side as well.
No worries. Does the pain radiate anywhere, or is it just?
It's just at my knee, yeah.
That's good. So is it a time of the day or a frequency that the pain's worse or anything like that?
It's often worse in the afternoon when I've been using it during the day.
Okay, so today I'm going to be assessing your knee through a bit of palpation, and I'm going to have to take your knee through some active range of motion and passive range of motion, some flexion and extension. I'm also going to have to manipulate your knee joints into a few different angles to test your ligaments for any damage, and I just wanted to double check for consent before we perform any of these tests.
Yeah, that's fine.
The aim of palpation is to feel for tenderness, swelling or excess fluid, temperature or heat, sensation or sensation loss, muscle bulk, and you should also try to identify the key bony landmarks of the knee. The clinical purpose of range of motion testing is to determine if the patient has the required amount of movement, flexion and extension at the knee to complete activities of daily living. ROM is also typically used to help determine different pathologies and assess the end feel of joints. When testing range of motion and joint end feel, make sure you test both the non-affected and affected limbs or sides of the body. It is always recommended that you test the non-affected side first. When measuring ROM, it is important to consider things like muscle length, joint end feel, and the tools you use to measure the patient's ROM. After you complete a ROM assessment, it is important to document the outcomes of active and passive range of motion and joint end feel. It is also important to make note of any other concerns such as instability or pain at the joint. Based on the patient's injury, I've chosen the posterior jaw test as a positive result will confirm a suspected PCL tear, as the posterior jaw test is used to assess the integrity of the posterior cruciate ligament. This test is positive if the tibia translates posteriorly in excess amounts. It is recommended to clear the PCL of injury before completing an ACL assessment. Normally with a PCL injury, the tibia will sit posterior to the femur, and this can give excess anterior movement when testing the ACL. This would be a false positive when testing for the ACL. Hence why you need to rule out PCL of injury first. When completing the posterior jaw test, you need to have the patient lying in supine position with the hip flexed to 45 degrees and the knee flexed to 90 degrees. You can fixate this position and stabilize the limb by sitting gently on the foot of the patient. Then you need to palpate the joint line and push the tibia posteriorly. Based on the patient's injuries, I've chosen the anterior jaw test. As a positive result will confirm a suspected ACL tear, as the anterior jaw test is used to assess the integrity of the anterior cruciate ligament. This test is positive if the tibia translates anteriorly in excessive amounts. When completing the anterior jaw test, you need to have your patient lying in supine position with the hip flexed to 45 degrees and the knee at 90 degrees. You need to fixate this position and stabilize the limb by gently sitting on the foot of the patient. You need to palpate the joint line and try to move the tibia anteriorly. Based on the patient's injury, I've chosen the Latchman test as a positive result will confirm a suspected ACL rupture. This test is positive if the tibia translates anteriorly in excessive amounts. When completing this test, you need to have the patient lying in supine position. You then take the patient's leg into 30 degrees of flexion, both at the hip and the knee. Then you can fixate the femur on the lateral side with your outer hand and bring the tibia into slight external rotation. Then hold the tibia inferiorly, slightly posterior to the knee joint, and then attempt to translate the tibia anteriorly. Based on the patient's injury, I've chosen the valgus stress test as a positive result will confirm a suspected MCL rupture or tear. This test is positive if the patient feels a reproduction of pain or if there is excessive gapping on the medial side of the knee. When completing this test, you need to have the patient lying in supine position, then you hold the patient's leg just superior to the ankle joint on the medial side of the leg, and then you fixate the femur with your other hand just superior to the knee on the lateral side of the leg. And then take the knee into 20 to 30 degrees of flexion, then slightly externally rotate the tibia and perform passive adduction at the knee joint. While checking the patient for any MCL damage, it is a good idea to clear the patient of any serious LCL damage as well. The various stress test is used to clear the LCL of any damage or rupture. You need to have the patient lying in supine position, hold the patient's leg superior to the ankle joint on the lateral side of the leg, fixate the femur with your other hand just superior to the knee on the medial side of the leg, take the patient's knee into 20 to 30 degrees of flexion, and then slightly laterally rotate the tibia and perform passive adduction at the knee. It is important when testing a patient for specific pathologies that you test both the affected and non-affected limb with testing of the non-affected limb first. It is also important that you document all of your results from the session in the SOAP format. Thank you for listening.